and welcome to Inside the Americas. I'm Ketevan Gorjestani in Washington, D.C. We're on the National Mall, an area that should be filled with tourists this time of year. This week, we're bringing you a special edition from the United States to show you how the country is dealing with the coronavirus outbreak. First, we'll go to Baltimore to see why African Americans are disproportionately affected by COVID-19. Then we'll head to the epicenter of the U.S. outbreak, New York City. And finally, in Los Angeles, we'll show you what money can buy you during a pandemic. The U.S. now has the world's highest number of coronavirus cases as well as deaths, but early data show that one demographic group is being hit harder than others, African Americans. Numbers from Louisiana are the most staggering, with blacks making up more than 70% of deaths, despite representing just about a third of the population. The explanation lies in decades of racial inequalities, leaving African Americans more exposed, more at risk, and less informed to face the virus, as we found in Baltimore. A coronavirus testing site in the middle of a race course. The city of Baltimore recently opened this testing location after data showed that this area of northwest Baltimore, where 95% of the population is black, had the highest number of COVID-19 patients in the city.
It was inevitable. It was going to come anyway to us. We get everything. It's getting harder. People getting prepared because people are going to be really broke, really stressed out, and when you're in them kind of neighborhoods, people start preying on the weak. The best that we can do is just keep the house clean and stay away from people, try to keep people away from us.
I have COPD, and I know it can infect me quicker, so I just stay in the house and do what I have to do in the house and get my son to do everything for me.
Are you afraid?
Yes, I'm very much afraid.
Data published by the Center for Disease Control shows African Americans are disproportionately affected by the coronavirus. Here in Maryland, black residents make up less than a third of the population, but represent 37% of COVID-19 cases and 44% of deaths. For Dr. Slocum, the coronavirus is simply emphasizing pre-existing inequalities.
What COVID-19 does is it illustrates and exemplifies the disparities which already exist in our healthcare system already. So, as you can imagine, access to healthcare, pre-existing conditions are some of the things that are most prevalent in communities of color. So when something like this hits, of course, it's going to hit communities of color more rapidly, harder.
Underlying conditions like diabetes, obesity, or lung disease are more prevalent among African Americans, making them more vulnerable to the virus. But blacks are also overrepresented among frontline workers like bus drivers, nurses, or food workers. More exposed and more at risk, African Americans are also less likely to have the resources to face a pandemic.
Poor people are more vulnerable, and it's not because of biological structure or anything like that. It's because of all the underlying factors that don't get addressed because they're poor and don't have access to the resources, medical resources, etc., to respond to it. Health information, resource information, healthy eating, access to information is a major issue.
Keeping the community informed has fallen back on local figures who use any opportunity to remind people how to stay safe and take the virus seriously.
Stay 6 feet apart. Folks, I'm gonna tell you something. You don't have a mask on, you need to start wearing a mask. This thing is no joke out here. Got a lot of people dying, a lot of people getting sick, and you heard the news lately. They're saying, especially with black men.
Baltimore community leaders are also worried about the economic impact of the outbreak in neighborhoods that are already struggling financially, a fear that is common to communities across the country. Just like in D.C.'s Georgetown neighborhood, businesses across the country have been forced to shut down, resulting in millions of Americans being laid off. Nearly 17 million lost their job back in March, and millions more are expected to follow. And despite the help provided through the recent stimulus packages, many Americans have now been forced to turn to food banks and charity to survive. That's especially true in New York City, the epicenter of the U.S. outbreak, where Céline Bruno and Jessica Le Masurier met with New Yorkers others struggling to make ends meet.
The queue for this food bank in New Rochelle stretches right up the street. This town in Westchester was one of the first places in New York to be hit hard by the coronavirus crisis. The subsequent shutdown had a devastating effect on the local economy.
What we've seen is a lot of members of our community losing their job. If we can alleviate and help families with this area, which is about produce and having to avoid to go to the supermarket and spend money and use that money for medical supplies or rent, we are able to help the families with at least the nutritional aspect and alleviate as much as we can the food insecurity in our community.
This New York City suburb is very diverse, both racially and socioeconomically. Amongst the most vulnerable, New Rochelle's large, undocumented population. For them, this food bank is a lifeline.
No tenemos comida ni nada, entonces eso ayuda perder la semana, salir por la semana. Realmente la situación sí está grave. ¿Por qué? Porque nosotros, por ejemplo, yo no trabajo, me dedico a estar en casa cuidando de mis dos hijos. El más pequeño tiene asma. Mi esposo, por ejemplo, ahorita ya tiene 2 semanas sin trabajo, que es el que estamos dependiendo de él.
Claudia and Anna are not sure how they will manage to keep paying the rent, but at least for now they can practice social distancing. That's something that's impossible for New York's homeless. The Bowery Mission in Manhattan is doing all it can to help them during this difficult time. Usually there are 200 people here every day for lunch. Now there are 500. Homeless people are amongst those most at risk. Their health is often fragile and it's hard for them to wash regularly.
We're telling people hygiene is so important, to stay clean is so important, but where are people going to wash? And so that's why we've added bathrooms here outside the Bowery Mission. That's why we have a hand washing station for people prior to the meal. That's why we have this shower van here so that people can actually get a shower. We're doing it all outdoors.
As well as meal distribution, Bowery provides housing for 325 homeless people across New York. Daniel has been living in one of Bowery's overnight shelters for 3 months. He's aware of the dangers of living in a common space and tries to minimize the risks.
We do the best we can. We take precautions, we wear gloves, we clean our areas 4 to 5, 6 times a day. If somebody is ill or has symptoms of being ill, the staff immediately takes charge of the situation. That person is sent to either a hospital or to a testing site.
Many shelters in New York City have been contaminated with the virus. In April, New York City Mayor Bill de Blasio announced that 6,000 homeless people would be relocated into empty hotel rooms to help stop the spread of the virus.
Everybody is subject to this virus. I don't care how smart, how rich, or how powerful you are. Those were the words of New York Governor Andrew Cuomo last month. But far from being the great equalizer that some expected, the coronavirus has instead exposed the devastating inequalities of American society. From getting a test to staying at home, our team in LA found that facing a pandemic is a much different experience for those with money.
All right, do you have an appointment?
People here have to wait up to 2 hours and are not allowed to get out of their car at this drive-through COVID-19 testing center. California, like a lot of the country, has a shortage of tests. As a result, only people who are 65 and older or have a pre-existing condition are allowed to get tested, which creates helplessness and frustration for a lot of Californians who don't fit into that criteria. To get around these regulations, wealthy Americans will eagerly pay the price, and no price is too high. They can call a concierge doctor, paying at least $5,000 a year for 24-hour VIP service.
We take care of a lot of different CEOs, executives. We have a lot of celebrities. You know, we limit the number of people that we see, so we have more time and we can provide more care to the patient. And then if patients need the COVID-19 testing, we charge an additional fee.
The cost? $600, which includes 2 consultations. California has issued a stay-at-home order for all of its residents, but in reality, many don't have that luxury, like sanitation workers or these nurses who are protesting because of the lack of protective equipment they need to serve patients. At the other end of the spectrum, wealthy residents can afford luxury, and some are renting hotel rooms to replace their offices in this upscale hotel.
It's really for that person that wants to feel safe, secure, have the privacy of an office on a day that I work from home, and my wife is in the house working from home, and the dogs are barking. This could be the end of some marriages.
In Beverly Hills, the houses cost tens of millions of dollars. For people who can afford these houses, the demand for private bunkers and underground shelters has skyrocketed. A company called Vivos has bought 1,000 underground shelters in South Dakota. The American Army stored bombs at these shelters before they were converted into fully equipped bunkers, costing between 17,000 and several million euros.
Our sales are up over 400%. People are finally getting off the fence and realizing, whoa, this stuff can happen. It is happening. It's not crazy.
And for CEO Robert Vecino, this pandemic could lead to chaos.
When people come knocking on your door or banging on your door, wanting food, wanting a handout, wanting whatever you've got. And at that point is when it becomes dangerous. And I think we're 30 days from that date.
Several buyers are already using their bunkers just in case the worst happens. Whether there will be a catastrophe or it's simply precautionary measures, the richest in America do not lack options to stay safe.
That wraps up this special edition of Inside the Americas. Thank you to Fanny Allard, Mathieu Mabin, and Stéphanie Cheval who prepared the show. And thank you for watching. Do stay tuned for more news on France 24.